Hi everyone, welcome back to our Monday Health Sharing. So before we start, there are of course rules and regulations that you need to follow, and actually we need your cooperation. So before we're waiting the others to come in, so let us share the rules. First, participants are required to mute your mic. So when speaker is sharing, please don't turn on your mic. So the second is better for you to turn on your video so we can take a screenshot during our sharing seasons. So the third one, that will be best for you to change your Zoom ID if you have any questions, because we are going to have a Q&A section at the end of the season. So if you have any questions, so that we know who are actually asking the questions, so it's better for you to change your Zoom ID. And the last one, as what I said, that we are going to have like 15 to 20 minutes of Q&A section. So if you want to ask questions, you can just type a question mark in the chat room. So I'm going to unmute your mic at the end. Or actually, you can just straightforward to type out your questions. So I'm going to pick it up and actually ask our tonight host speaker, which is Dr. Jerry. So let us back to the topic, because now it's almost 8:30 and almost 8:30 and 35. Yeah. So let's back to the topic. So I really want to say it's my honor for me to introduce today's speaker, who is actually going to talk about us how to deal with the COVID-19 variants. The reason is because right now we are open back to work, right? I think a lot of people return back to their workplace, and they find out a lot of cases actually happen around them. So which is probably their friend or some of their family members, their relatives. So actually a lot of cases happen around, and actually they find out this time actually all the cases quite close to them. So they worry about it, because what I say, it opened up. So everyone able to jalan out there, or actually they can play out there, eat out there, enjoy their food out there. So it's quite dangerous right now. So they must have a way to deal with the COVID-19. So we are going to have our our host speaker today to share about us the way how can we deal with it. So who is he? He's actually a naturopathic nutritionist who has specialized in health consultancy. So he's also the Molecular Hydrogen Institute consultant and nutritional advisor, natural health protocol, and also a preventive health expert. So he has guided all the optimum health and well-being of some of this country very well-known people. So he actually attached with a group of clinics. So he has a lot of experience. So ladies and gentlemen, please join me in welcoming tonight's speaker, Dr. Jerry Chin. So welcome him. Dr. Jerry, are you there?
Yes, hi, Kenzie. Thanks for the introduction. Hi. Um, so as you can hear me clearly, you can see the slides. Everything's good. All right. Good evening, all. We're talking about COVID-19, but do you know now it's 2021? I think in a few months it's going to be 2022. So it's already entering our third year of fighting this disease. So right now we have a new challenge, because many of us have taken the vaccine, some one, some two, some none. But at the same time, we are dealing with a modified enemy, which is called a variant. So today I want to talk a little bit about the COVID-19 variants and what are the ways that we can help ourselves to deal with it. Sharing the stage with me tonight is a friend, Dr. Liao. He's with the government service, also a very experienced doctor. I thank him for joining us. He will cover a few interesting topics for us. He's a specialist in family medicine. He's very well experienced also with some of the natural treatments that we use. And as a trained physician, of course, he gets to look at the virus from the government perspective, whether you think it's good or bad. But every government in the world is also fighting the same challenge, okay? And even America today, you heard the news, they can't even agree whether you need booster, younger people need or not, and then to older people need a third shot, fourth shot, many shots. So this it's not just a challenge for Malaysia, but it's a challenge for the whole world. So what can we do? Well, let's hope that tonight I can give some insights, okay? Let's move on. Before I start, of course, I have to tell you that this is a Zoom session, so there's no way I can treat your disease or give you advice that's relevant to your individual disease unless you make an appointment at the clinic and then we meet each other and go through. So the information here is strictly for your education, so you can increase your knowledge You can look up all the different things that I'm going to talk about. So that is the disclaimer that I have to start with. Now, I think by now everybody know what is a virus variant. Okay, why? Because the virus mutates as it spreads. It changes itself. In fact, the very first virus that came out, called the alpha, is already a first mutation. It's not exactly the same as the original virus that was first discovered in China, Wuhan. So it's already mutating, and now there are a lot more mutation. Some are harmless, some are dangerous. So as I say here, it can be more or less infectious, that means can transmit very easily, or it can be more or less severe, which means it can cause a more serious disease. As according to the WHO, of course, they classify it first. When they first detect a variant, they will call it a variant of interest, or VOI. That means not very serious yet, but we are watching it, we are monitoring it. Then it becomes something more serious as more people get it. Then it becomes a variant of concern. That means this variant is already spreading among the population, and you will notice that many of the variants come from certain country. Usually you notice a very populated country, from India, from Brazil, Peru, all these places. So we have to be, as you know, they will mutate more in crowded spaces because more chance to travel to another party. Okay, talking about the VOI, or variant of interest, these are the few ones that has not become dangerous yet, but it is being monitored. The most latest one that we have seen is the last one at the bottom, is called Mu, and it's B1621. They started from Colombia, again in South America, and you can see that the date destination was 30th of August was designated. So it has not become a dangerous one yet, but it has been discovered. In terms of the ones that are of concern, the ones that we are facing now and having a problem, as I told you, the first variant was the alpha. Alpha is the one that the pharma companies have been using to design the vaccine. But by now we have beta, gamma from South Africa, from Brazil. But the most dangerous one that seems to be spreading really fast is, we all know, is called the Delta, or the 617. Okay, this one started in India. So they start putting these names because they don't want to blacklist those countries, So Malaysia don't have our own virus yet. Hopefully not. But the ones that everybody knows and is talking about and is concerned is the Delta. So, of course, first question everybody asks me, or everybody wants to know is, hey, since I already got the vaccine, one jab or two jab, am I protected? Am I okay against the variant, or even against whatever? Obviously, as I mentioned earlier, the vaccines were designed for the alpha variant. So right now we're already up to the Delta, and maybe more coming, we don't know. So the efficacy rate of how much it protects you will definitely be dropped, which is why in this figure you see a range, 60 something to 90 something. Why? Because the measurement, the Delta is moving so fast and it's so new, they can't even capture all the complete data yet. And you look at this list, Sinovac and Sinopharm and all these Chinese one are not even in the database, because a lot of it is in countries that are in Asia, and many of the data are not documented. So we really do not have a figure. If you look at the news from the Chinese government, they say, well, for Delta, our Sinovac works just as good. But from a scientific basis, we all know that there will be a drop in efficacy. Even when they first said 90 something, it is just a figure that they calculated based on the clinical trials that they did, but only from the population trial, which is the whole world vaccination that's going on, we can gather more data. but it's obvious that it's dropping. There are a few other problems which I'll talk about, but basically, the answer is do not feel 100% safe that you are vaccinated. You are just as unsafe as before. You may be a bit safer from getting a severe disease, but we still have to be careful. Let me take a photo here. Okay, moving on. Johnny, can you share the video now? I dare not share this video because it will screw up my presentation.
The evolution of the virus that causes COVID-19 has been monitored and studied since the beginning of the pandemic. Viruses constantly change and become more diverse through mutation. Until the beginning of July 2021, the most common form of the virus that causes COVID-19 in the United States was the Alpha variant. Now, the Delta variant makes up more than half of all COVID cases in the US. The COVID-19 virus is a protein shell filled with genetic material that makes copies of itself inside the cells of a human. It undergoes genetic changes when it replicates itself and eventually makes random errors. Those mistakes are called mutations. They slightly change the instructions for making the virus. Mutations are often minor, and some can even make the virus less infectious. But sometimes, a series of mutations can make the virus more transmissible. That's what scientists have found with the Delta variant. This variant also evades some of the body's immune system defenses. The World Health Organization says the highly contagious Delta variant is the fastest and fittest coronavirus strain. Dr. Stephen Thomas, director of the Upstate Global Health Institute at Upstate Medical University, says it looks like it's at least 60% more infectious than the original strain that came out of China. Data from the field shows that the Pfizer and Moderna vaccines do offer protection against the Delta variant when you have the full 2 doses. On July 1st, 2021, Johnson & Johnson announced data that demonstrated its single-shot COVID-19 vaccine generated a strong response against the Delta variant and others. Pfizer plans to seek authorization from the Food and Drug Administration for a 3rd dose of their COVID vaccine, saying it would provide even stronger protection. They also announced that they had developed an updated version of their COVID-19 vaccine that would specifically target the Delta variant. Clinical trials are planned for August. But on July 8th, the CDC and the FDA released a joint statement on vaccine boosters. Americans who have been fully vaccinated do not need a booster shot at this time. On July 12th, a group of government doctors, including Dr. Anthony S. Fauci, President Biden's chief medical advisor for the pandemic, met with Pfizer representatives about booster vaccines. All of the experts agreed that so far, there is insufficient evidence that boosters are necessary.
Okay, can I continue?
Yes.
All right, good. I have to get back my screen though. What do I do? Johnny, just press the share screen.
Yes.
Just
Okay.
just press share screen.
Okay. Screen. I lost my share screen. Okay, good. So we have, I think the video was quite educational. It really explained everything. I don't have to say again. Right now, it says 50% of the cases in America is Delta, but actually I think it's gone up to 80 already. And in Malaysia, I'm sure Dr. Le will tell you that most of it is the Delta variant, which is why it's spreading faster. Our figures are maintaining higher. And of course, one of the problems will be the limitation on the hospitals, you know. So, Dr. Liao,
Yes.
first question for you. Can you see my question?
Yeah.
Welcome. Thank you for joining us.
Yes. Okay. Should I answer, right? Okay.
Yeah.
By the way, I actually am now working with Ministry of Health, but of course today I come in as guest, invited by Dr. Jerry as a friend to share my experience and actually of my point towards these variants in COVID infections. So yeah, my stand, it doesn't represent KKM stand. It's just that sharing today is what I thought and what others bodies said about these COVID variants. So when we talk about this breakthrough infection, meaning that is that you are fully vaccinated, but of course you got the infection, you know. So that is what we call a breakthrough infection. Like you are not supposed to get infection, but somehow you get an infection. So we how to say it? We say that this is called breakthrough infection when you are fully vaccinated. Because now actually you can hear a lot of people say that actually I'm vaccinated. Why I'm still get infected, or even as friends that you still get infected. You know, of course when you have this kind of infection when you are vaccinated. Study have shown that you like I think a Pfizer study have shown that you still have the about 96% that you wouldn't go 96% that you wouldn't go into severe disease lah. Yeah, but of course you still can be a carrier for that. Yeah, I think that's about breakthrough infection lah.
Yeah. So the main point about breakthrough infection is, you know, now a lot of places are going to open up for people to go in, dining and all that. So many people do not understand. They say, "Oh, I'm double vaxxed. I'm fully vaxxed. I can do anything I like," you know.
Yeah.
But remember, vaccine is never 100%. I already showed you. It can range from 60 to 90% depending on what it is.
Yeah.
And so whenever you get sick after a second vax, it is called a breakthrough infection, because the vaccine doesn't provide you 100% immunity. So you still have to be very careful when you go out. Okay. The second question that I want to talk about, many people ask is, you know, I was positive, now I'm negative, but I'm still suffering. So Dr. Liao, if you don't mind, share with us something about long COVID, or some people call it long haul COVID.
Yeah. I think this is something that if you find that in the Ministry of Health, the definition is all the signs or symptoms that you experience after 3 months, you know, after 3 months of an initial infection, you still have the symptoms, or you have other symptoms that is not explained by other diagnoses, right? You go to see the doctors after 3 months, you have a COVID, but you still get this. I think the common one is like fatigue, you know, people still get fatigue, still, they don't know what's the cause of fatigue. And also the second one, the most common one is like exertional dyspnea, what we call it when you exert yourself and you started to have this shortness of breath. You know, that is the two most common symptoms. But of course, we can have other symptoms like even like psychological symptoms like anxiety, or some people will get some post-traumatic stress, you know, because they need to be quarantined and they're very fearful, they're very scared, you know, when they got infections. So that's about the long COVID. Unfortunately, yeah.
Go ahead, Dr. Liao, finish what you're saying.
Yeah. But unfortunately, because this is something new, you know, we are in COVID, also not so new lah. Of course, evidence is coming out. We are in COVID for around 2019 till now. It's about 1 year plus, near to 2 years really. So there's not much treatment per se, you know, a specific treatment. We'll say like we call it a symptomatic treatment. Like if you like have shortness of breath, then maybe we'll refer you to the lung physios, you know, to boost up your stamina, these kind of things. So far there is no any what we say a good treatment for that, I would say. So in order to not to get long COVID is to not to get COVID.
Okay. I think one of the problems in Penang for long COVID, also one of the symptoms is you lose your taste of smell and taste. That's a big problem. You eat your laksa is bokao sui, you know, you eat your curry mee is bokao luak.
Okay.
That is a serious problem. It can last from a few weeks to a few months. That's one of the
Yes.
symptoms of long COVID.
Yes.
It's a joke, but then some people say, "Oh, I find everything so tasteless." So you see, so many things affect you, even though you are no longer positive. This is what we call long COVID. So I know, of course, from Dr. Liao's standpoint, there is no cure, but there are ways that you can take action so that even when you fall sick, it will not be so severe. We'll talk about it a little bit later. And at the same time, just understand that when you are negative, doesn't mean that you're fully recovered. So you have to sometimes go for rehab. We call it
Yes.
rehab, and personally, I know of certain, clinics and medical places are trying to look at how to best treat the rehab part of the long COVID. So now the last question is, the government is announcing that, okay, we're going to switch from a pandemic to an endemic. So I think many people out there, to them, everything is the same. The cases are going up. People are still dying. ICU still full. So just change the word. What does it mean? Can you explain a little bit,
Okay.
Dr. Liao?
Yeah, sure. Of course, we talk about demic. If you follow the Greek words, demic itself is like a group of people in the district, So we talk about epidemic first, means that it's occurring in the district, like initially, like just this COVID-19, it started at Wuhan. At that time, it just involved Wuhan. So there is an epidemic in Wuhan for this novel coronavirus, COVID-19 virus lah. So, of course, over the time, I think in March itself, 2020, it started to spread it to almost whole world. That's the time that actually WHO have declared it as a pandemic. Means that it's a serious problem spreading fast across the globe. So that is a difference between epidemic and pandemic itself. When it's endemic itself, it means that it's in the community itself. So, but when we reach the state of endemic, it means that we reach a state that in a more controlled manner, we can predict what is the what we call the incident rate, how many cases, and our facility can cope. This is by this what government that what they do, that they do vaccination. They hopefully that they will come into the endemic stage. It's just like our dengue. We'll talk about like every week or maybe every 2 months or every few months we'll have dengue cases. These kind of things. So, but it's in a controlled manner. Our facilities can cope. It's not as something is out of hand. So that is what government should move to. So they say you have to live with the virus. You have to acknowledge the existence of this virus. Have to live with them. It's just like Singapore. They open up almost everything. They say, I think like Singapore is one of the few first country that said they need to live with the virus. So they have to they have to acknowledge the existence of this virus. And personally, I think it's gonna be something like flu later when things go on. And because when they are spreading in communities, meaning that there's a chances of mutations. So you have more and more strains, I would say. So by that time, maybe our first vaccine may be not so suitable. Like if even our flu vaccine that we update every day, we depend on the strain that's more prominent during that the year of what kind of flu, like H1N1, H1, it's just that the protein coding, So I think moving forward, I think that might be the picture. I might be wrong, but this is what I see in the future. Yeah.
Thank you, Dr. Liao. Well, that's endemic. We're going to be soon living in an endemic, which means from time to time, certain groups of people will fall sick. A certain number of people will die. Later on, I'll share with you what are the risk factors to escape death and how to protect yourself. That's the second part. But endemic means you cannot wake up one day and say, oh, no more COVID-19. We can all celebrate. No, there is no endpoint anymore. The end point is it is going to be there. So which means what? There will be more vaccines coming up because they have to change the vaccine from time to time. But I'm confident that the scientific community will always eventually come up with some cure. to minimize. But whatever cure it is, a few people will have it severely and they will die because of the comorbidities that they have, the risk, the higher risk that they have. Thank you, Dr. Liao. I'll continue with some of the presentation here.
Okay, most welcome.
So, what is it like living in a pandemic or in an endemic? Well, maybe there won't be severe lockdown, but there will be restriction in your movement. Okay. I will come back to your underlying risk. This is something you should take a photo and you should remind yourself. And then I want to talk about what are the external protection that you can take to prevent you from falling sick or getting infected. And what is the innate protection? Innate means you're built in, your own internal firewall. That is the most important. When you have virus trying to come into your computer, you want to have a firewall. So you need an external firewall. You also need an internal firewall. And the most important thing is do not be fully overcome by fear. Of course, you have to be cautious. You have to use a lot of common sense to deal with this virus. So the top risk, you see the figure on the right, anything above 1 means it's a higher risk. So 1.3 means you are 30% higher than a normal person. So look at it. This is the COVID-19 risk of death. Let's not talk about falling sick because anybody can fall sick, but some people will get well in 2 days. Some people will die in 3 days. So what are the highest risks of death? Notice number 1 is obesity. Obesity means what? Overweight. Overweight means what? You're unhealthy. Unhealthy means what? You're big. Overweight, so your heart have to work harder. Okay? Your heart is weak and your blood circulation typically will be bad. Your body will be very inflamed. So during this lockdown, I know some people put on weight, but that's not good. The idea is to lose weight. Okay, so you need to immediately go on a program to lose weight so you won't be obese because that is the number 1. And see, number 2 is fear, anxiety and fear. I think you hear of many people having some mental disorder. You see the divorce rate going up very high. You see suicides. So it is a true problem because you are anxious. Am I going to get paid? Am I going to get my money? Am I going to lose my job? Will my families die? I see so much panic, when people call me and say, oh, I'm infected. I'm worried, my whole family may be infected. So anxiety and fear related disorders, okay, it lead to stress, it lead to a very inflamed body, and it is also one of the highest risks. Very close to that is, of course, diabetes. Okay, chronic kidney disease, neuro disorders, and then, of course, lung-related diseases. Okay, all these diseases, let me tell you, when we talk about younger people being fitter, actually the data show that the young people who die, they have high blood pressure, they have diabetes, but they don't know because they think they are young, so they never go for any checkup because there are many silent killers. If your sugar is high, some of you may not feel any symptom. So you assume you're 40 years old, you're okay. Some of you may already have hypertension. I see many 30, 40-year-old people, 200 over on their BP, but they don't know because these are silent killer with no symptom. So when you get the COVID, you are at a high risk. Okay, old people, of course, their immune system is low, so they have those problems. So look at the top. These are the top 9. I've got thyroid disorder, coronary, heart disease, and all this. So if you have any of these, you're at a very high risk. The other risk that you have, and this is, we call it oxymoron, is like when you are supposed to stay safe at home. We get the message, stay home, stay safe, don't go out. But do you know that staying indoors weakens your immunity? Why? It's very simple. When we go out, we will catch microbes, we will we will catch some germs, we will get some infection, bacteria, but majority are harmless. That's why children, when they grow up, they're supposed to catch some minor diseases, fall sick, and recover. The more you recover, the more your immune system gets challenged and your immune systems improve. So if you live in a bubble, like you totally clean environment, your air is clean, sanitized, perfect. The moment you go out and the moment any microbe hits you, you will easily get infected. Why? Because our immune system needs to be challenged. It needs to work. Otherwise, it switch off. It doesn't know what to do when you get attacked. Okay? So what I'm trying to say now is staying indoors all the time is not necessarily the best thing to do. But going out, you also have to be smart. You have to have ways to protect yourself. And in all circumstances, you should go to ventilated areas. Why? Because the air will move viruses around and you will not be exposed to increase something called your viral loading. Okay? One thing about how the virus works is once it hits you, it will replicate. And if you continue to take in more, it will replicate even faster. And the loading, the amount of virus in your body increases very fast. And something about the Delta variant is it replicates really fast. And as a reminder, which we spoke about just now, just because you're double vaxxed doesn't mean that you're 100% safe, okay? Even though you have all the vaccination, just move around as carefully as you always do, okay? Now, how do you protect yourself? This is the take-home message that you need to have. Every household, whether yourself or shared, you must have a good quality thermometer and a good quality oximeter. I've seen some oximeter that is not accurate. Why is oximeter important? Because the COVID virus is a respiratory virus. So it affects your airways. It affects your ability to breathe. So when your oxygen drops, you will know that you already have a blocked airway and you will have a lot of problems if you don't act fast. And breathing affects you really fast, okay? The second thing we have to care about is our hygiene. Many of us live in a dirty world. Food is dirty, outside is dirty. But now we have to be careful with hygiene. This virus spreads through the air. It also spreads through you touching yourself and things landing on surfaces and things like that. So you got to practice hygiene in wherever you go, like taking a shower the moment you come home, spraying your throat and things like that. Number 3, I don't want to spend, because each topic I can talk 1 hour, so I won't cover it. I think there's many news out there you all would know. When I say masking is don't just wear the mask because somebody asked you to wear. Do it smartly, because you don't want the mask, to have a lot of entry point at the side, and you don't want it to not be able to keep out the virus. And also, if you are sick, stops you from spreading to other people. What I do myself is I use antiviral sprays. Some people use colloids of silver, some people use colloids of copper. There was a recent research done that, you go everywhere now, they spray with all the chemicals. Well, first of all, many of the chemicals are antibacterial. They are not antivirus. So it doesn't really do anything to the virus. It makes you feel better. It makes the shock feels better. But a lot of it, I would say 80% of the ones sold outside, they are not antivirus. You have to check the spec that it is antiviral. Many of them put their antimicrobes, antimicrobial, antibacterial. These are the most common ones. Why? Because the virus is difficult to kill because of their lipid protein shell. Where the spike protein is, that's how it protects itself. So what I do is I use colloids of silver. Some people use colloids of copper. These are ionic, low concentration of these metals that can break up the virus. I use silver because it is safe. I can spray on my throat. I can spray on my mask. I can spray in my car. I also use some low-level ozone to treat the space where I work. And of course, very important, is to take antiviral supplements. I think my pharmacy friend is telling me that, yeah, many supplements are selling very well, but you have to be careful because sometimes wrong dosage, poor quality, and not taking the right balance. Next slide, I will share with you what are the key supplements that you need. And then immune optimization. How do you protect your immune system? I'll talk about it. And since COVID is a breathing disease, it's a respiratory problem. So let's talk a little bit about the respiration side. So in terms of protective supplements, there are two types. Okay, you have the viral protection. I think many of you already know about this. It's all over the WhatsApp group and everybody is talking about it. Vitamin D3 is essential, but make sure it's 5 to 10,000 IU. What is D3? D3 is a sunlight vitamin. So in colder countries, it's even worse, you know, when the winter comes. But over here, we have the sunlight. But as I said, if you stay home and stay safe and you don't get the sunlight, then how are you going to get your vitamin D3? So you need to consume it, and you need a high quality one because not many types of vitamin D3 out there is not easily absorbed. Another very powerful antiviral is zinc. We all know that, you know, we take zinc for flu, influenza, vitamin C, which obviously you can also get from fruits, but you need, you know, 1000 mg once or twice a day. The other less common and you probably not so easy to find would be quercetin, selenium, which you need in small amounts. Selenium, of course, you can get some in eggs. Melatonin, if you know melatonin is naturally occurring in your body, it is also a hormone that helps you to sleep and relax. It is quite a wonderful hormone. It is anti-cancer. It is also antivirus. And then something called NAC, you know, which is also very antiviral. So these are the key vitamins. Of course, you on top of that, you can add on vitamin A, antioxidant, vitamin E, and vitamin B6, B12. So basically, it's all the ABCD, all right, plus all these things. But this is the best that you would need as a minimum. And since we're going to be taking a lot of vaccine, we don't know whether boosters are coming. Looks like with the variants, there will be boosters coming. We have to talk about the toxin flush, okay? Because to make the vaccine, of course, they have to include small amounts. They call it trace amounts of aluminum, metals, which by right your body should be able to handle. But if you're going to take multiple shots, it could have some side effect for some of you. So it's very important that part of the toxin flush must include, of course, D3 again, NAC, something called ALA, quercetin, zinc, milk thistle, something very powerful for toxin flush will be PQQ, astaxanthin, and we come back to melatonin and K-iodide. These are all the things that are important to clean out your body, not only from leftover things, but, you know, in the past, maybe you've been taking a lot of toxins into your body. So these are the protective supplements that you would need. If you don't know where to get all this, you can message me. Of course, very controversial, and you guys, if you haven't heard about this, that means you have not been in the health group. But everybody's talking about ivermectin, right? I put a question mark because there's a lot of debate going on. Even though it's a very old drug, it's got a 40-year history. It's an approved drug for animal and human, but for anti-parasite, you know, it saves a lot of lives. The inventor also got the Nobel Prize and all that. But currently, it's not approved by WHO. It's even not approved for Malaysia government for COVID-19. But it's already used in many countries because they cannot wait. Because the vaccine rollout is slow, some of them cannot afford the vaccine. So this is the best alternative for them. Of course, many countries like India, Peru, South Africa, they say that they're getting good results. But many of those trials were done individually. There was no time to go through very proper trials. So in Malaysia, we're doing a small trial this month. I don't know when the result will be out, but right now it can only be used in the clinical trial environment. But if you were to get your hands on some ivermectin, the most important thing is beware of the fake, beware of ivermectin that is designed for animals, because majority of the ones sold in Malaysia is for animals. Be careful about the wrong dosage. Either you don't know how much to take. More doesn't mean better. You got to take the right dosage, and be careful with certain tablets that has impurities. Okay, so be very, very careful. And at the same time, how ivermectin supposed to work is it stops the virus from replication. That means it stops the virus from getting more and more and more, multiplying. So what does that mean? It's important to start early. And the second thing, very important, if you were to try this, is to take it with proper supplement. What are the proper supplements? Look at the top line. These are all the things you need, irrespective of what you do. Okay, even if you take vaccine, because remember, when you start with the vaccine, your immune system will dip for 1-2 weeks. And that is the dangerous time, because when your immune system dips after the first shot or the second shot, that is the time that you can easily get infected. All right, don't be a hero. Don't say that, oh, I got my second shot, now I can, go to the pub and do everything that you like to do. So be very careful. You want to know more about this ivermectin and study some of the controversy, you can visit this website called flccc.net. It's started by a group of doctors who believe in this, and then they created this website to give some guidelines for certain people. Okay, I'm not here to promote, to say yes or no, because it is still not approved for COVID, but it is approved for parasite. If you have a parasite problem, of course. And many many animal hospitals, of course, they carry this because it's approved for parasite for both animal and human. So I talk about your innate immune. That means your internal firewall. So what are the best options? I already said, make sure you take your supplement. Okay, the right dosage again. Don't waste money and overtake or undertake. You got to take the right amount. Number 2, you need sunlight every day. We live in a tropical place. There's plenty of sunlight, but some of you, I know, stay indoors in a condo. You hardly go out. So it is important you go out to a ventilated place and do whatever exercise you can do. It can be heavy, light, whatever to your liking. Even walking around, it is good exercise. All right. Your diet. Of course, as I said earlier, the number 1 risk is obesity, putting on weight. So you must eat something that doesn't make you put on weight, and you got to try to eat diet that has a lot of vitamins and minerals. Okay. The second cause of death is our mental health. If you have anxiety, fear, so what do? Talk about it. If you have friends who are, that is depressed, really worried, it's okay. Ask them to join this group. Join our 125 group. Make friends. You don't have to buy anything. You can just get to know, because the people here knows about health. Not everyone is a doctor. Not everyone is qualified, but we have many. We have nutritionists. We have medical doctors. I think our team has the largest, and they're all well trained, and many of them are listening in today, so they can give a lot of good advice to you. Okay, so never be alone. Okay, don't just join this group that share bad news with you. Oh, today who died? Today my neighbor died. Today the curry mee seller died. These are the news that people like to share. But I think for us, let's share about how can we be healthy? How can we be, not the one that die or not the one that fall sick? So that's the positive group. So in this group, we don't talk about getting, facing death. We talk about getting healthier. Okay, so make friends, join a healthy group. The last thing I want to talk about is, as Kenzie, who introduced me, mentioned, I'm a MHI consultant. What is MHI? MHI is Molecular Hydrogen Institute. It is a school and an institute in America that specializes in using medical hydrogen. All right. And they do not support any brand or promote any particular brand. They just provide education and support the concept of using hydrogen as a medical therapy that has zero side effect. So let me share a few thoughts about that. So how do I get this hydrogen into my body if it is so good? First of all, you got to realize in your body, there's already 10% of hydrogen. Always in your colon, in your lower stomach, there's 10%. from the fermentation. Why? It needs to feed the bacteria. The good bacteria, probiotics that you have in your colon needs hydrogen to survive. So from the sugar and the carbohydrate that you eat, the body will ferment hydrogen. So at any one time, we have about 10%. Now, how do we add in more hydrogen for ourselves? Number one, of course, we drink the hydrogen water. You can see the picture there. There's one small little tumbler and that makes hydrogen water. The other thing is to inhale the gas. As you know, gas is very fast. So you can inhale through the nose, or you can infuse through the eyes, through the goggles, or through the ear. Number three, of course, you can inject in a serious case. You can use concentrated water bath. Of course, they have spa like this in certain places, like Japan. Now, coming back to the water, this is not a water filter. You know, many people think that, oh, I already have a water filter at home. I have this filter, ionizer, alkalinizer, everything. But be careful, because what we are talking about is nothing to do with water filter. You still have to put filtered water inside, but it is a water processor that enhances it. Okay, it makes the water change into a therapeutic water. Just imagine if you drink 500 ml of this water, the antioxidant value is equivalent to what? 400 apples. So you can either drink this water or you can eat 400 apples. Of course, this is just a straight comparison for the antioxidant value. Apple has other things, right? Apple has enzymes. Apple has fiber. All these things are good for you. Apple has other phytonutrients which are good for you. But in terms of the antioxidant value, if you just compare 500 ml of a proper hydrogen water can provide that much of value to you in terms of something called the antioxidant value. At the top here on the left, you see the bigger machine that you put at home, 6 liters of water. At the bottom, you have the portable one, 260 ml that you can carry around, very convenient. So this is one of the ways that you introduce hydrogen into your body. So important for your blood circulation, for your digestive system, for your bladder system, kidney system, liver system, everything to do with blood circulation. Which part of your body doesn't have blood? Every part has, including your brain. So water is critical because 83% of your blood is water. In terms of the hydrogen gas, I mentioned that you can infuse it into your body 3 ways. On the left, I'm using the goggles. You can start with 30 minutes. You can use it twice a day. In the middle, I'm using the earplug to put into my ears, which will also help infuse my brain. It's very good for people with brain challenge symptoms. You can do it for 30 minutes first, and you can do it 2-3 times a day. Please stop if you have a headache, dizziness, because these are some of the healing crises that you may go through. And on the third picture on the right, you see me inhaling both hydrogen and oxygen together. You can do this for 1 hour, once or twice a day. If you have very serious disease, then you may need to do more. Now, why are we focusing on this oxyhydrogen? When COVID happened in China, of course, they were the first country we mentioned when it started as an epidemic there. And this Professor Zhong is a SARS expert. He was the one who discovered SARS in 2003. So he did a study in 32 medical centers using not oxygen, using hydrogen plus oxygen. And he was able to show the real benefit of using the two together, not just one. We all start looking for oxygen, because our oxygen is low. But over there, they already know that just using the oxygen alone is not as effective as combining it with hydrogen. Why? Why is that happening? Because look at this. I know some of you don't have chemistry knowledge, but never mind. Make it simple. Oxygen gas, the molar mass, which is like the weight, is 32 grams per mole. And hydrogen is how much? It's 2. Molar mass means O2 lah. O2 is 32 gram. H2 is 2 gram. The air that we breathe, because it's mostly oxygen, it is 29 gram. So what happens? Hydrogen is 16 times lighter than oxygen. That is why when you are sick, it is so hard to breathe. You realize that? We take breathing for granted. You know, today I'm talking, I'm breathing, you're breathing, everybody's breathing. But wait until you are fatigued, wait until your lungs are blocked, wait until you have to exercise for a long time, up climbing the mountain, you will suddenly realize that, wow, oxygen is very hard to take in. You're out of breath. So when you're in the ICU, they have to use an oxygen concentrator to force the oxygen into your lungs. And that is why you will get lungs damage, because you have no energy to breathe by yourself. If it gets worse and worse, you'll be only on life support. That means you are not even breathing. The machine is breathing for you. So what is the danger of pressurized O2? You have lung injury. It can be induced, it can be acute. So this is just now Dr. Liao talked about long COVID. People coming out from COVID already recovered, no more positive, but they suffer this. They suffer acute and induced lung injury. So they will have fatigue, they will have tiredness, they can't really exercise much. And this is long, it stays for months, even years. All right. So in China, when they start using the hydrogen and oxygen concentration, when they did the medical tests in 32 medical centers, this is the combined result. You look at cough, shortness of breath, chest pain, chest tightness, even depression. We talk about depression. It's good that they measure that because that's a very important factor. When you are in ICU and you don't know whether you're going to live tomorrow, you close your eyes, maybe tomorrow you won't open your eyes because you find it so hard to breathe. If I strangle your neck halfway, I'm sure you'll be very depressed too because you don't know whether you're going to survive. So it's good that they measure depression. But look at the recovery. We are talking about days, not weeks. Second, third, fourth day, they already start dropping drastically. By the first week, this is the combination of all the tests that they did, okay? There are many reports. This report is like 200 over pages long. You can buy it, read it. This is one typical patient. If you see on the left, that is what happened to your lungs. And I mentioned VILY, ventilator-induced, and hypoxia, acute lung injury, HALI. You see the recovery. This is in 5 days of using combined hydrogen with oxygen. Okay? And these are, besides what is done in China, these are the other independent studies just on COVID and SARS type of influenza. Okay? The oxyhydrogen therapy for COVID-19. You can read all that, but it's all there. So what is happening? What is happening here is, look at this person. What is happening here is you need the oxygen. You need the oxygen to survive. Without oxygen, you will be dead. But when you have hydrogen, what happened? This is very important. Look at the blue line. The hydrogen is 16 times lighter than oxygen. So when you combine 66.6% and 33.3, which is 2 to 1, what happens? Suddenly your air is 4 times lighter, very much lighter. So which means the oxygen can go in easily because the hydrogen pulls it along. That is the first benefit. And what is the second benefit? Hydrogen is very anti-inflammatory. When they put you on oxygen in the hospital, they have to include steroid to reduce the inflammation caused by the oxidation. So therefore, hydrogen is the natural anti-inflammatory without steroid. So hydrogen, first job is to bring his friend oxygen in to help you. Second of all, hydrogen itself can reduce the inflammation. Why? Because inflammation is what kills you. You get a storm, inflammation storm, that your organs start failing. Okay, and the third thing is hydrogen is also an antioxidant. It will get rid of all those free radicals that is created because you are very sick. So all your organs will be creating lots of oxy radicals. And hydrogen is a selective antioxidant. It will target the bad radicals. It will not target the good radicals that you use, like nitric oxide. Okay, so it is different from other antioxidant because it is a smart antioxidant. Okay. Now we talk a lot about COVID, but when you talk about hydrogen, why I study so much on it is because there are 1,000 over studies. I didn't read all, but I read the key ones, the main one. But look at the number of disease that it can help. You know, of course, diabetes, hypertension, neurological dementia, even radiation damage. Is very powerful for radiation damage, which means what? If you have cancer and you choose to do radiation, hydrogen water and hydrogen gas is a must. It's a must. In our clinic, we use it in conjunction with other cancer treatments. It also has an anti-aging effect. Okay, many of the ladies here already start using it, and you can see your face, your wrinkles getting better. Great. That is the end of my presentation today. I want to talk about the COVID itself and some of the benefit. We have a few people here who have been using this hydrogen, and maybe it'll be nice. First person here is, I met him before, our friend from KL, Klang. His name is KL, sorry, it's Kelvin. And I think we have him on video, right, to talk about his experience with COVID-19.
Yes, maybe Joni, he can play the video. So, Dr. Jerry, maybe I introduce Kelvin.
Sure. Oh, he's in here also.
No, he's not here. No, I just briefly talk about his story. I can summarize his story because I think people are listening. So maybe because Kelvin Ning, he's going to speak in Chinese. So for people that only listen English, maybe I can do a summary here first before we start.
Okay.
Okay. So Kelvin Ning is actually from Selangor, like Dr. Jerry said. So he was actually informed by his doctor that he's actually positive COVID. So he quite afraid about it. So during that moment, he's really lucky because what happened? He told his upline that, oh my God, I'm actually positive. So his upline actually delivered him the hydrogen purifier on the second day. So he get it the second day. So he's so lucky because he mentioned about one thing. He's so worried about all the symptoms because he heard a lot of stories that people going to have like headaches or actually not about to breathe. They are so difficult, a lot of uncomfortable feeling, and also here and there, of course. So he worried about that. So he called to his upline and talked about his positive case. So they respond so fast. So his upline is actually deliver him the hydrogen purifier. So he able to get it. So how he do that? He's actually take it 1 day 3 times, every times 2 hours, the hydrogen and the oxygen at the same time. So he actually so lucky. He's, as what he say, he don't have any symptom during the 14 days. So he didn't feel any difficulties, like he don't feel any headaches. He's not falling sick. He didn't cough at all. So he feels so good because of the hydrogen purifier. So he also shared about a story about his friend because his friend is actually passed away because of the pandemic. So he feels so sad about it. But during that time, he wanted to deliver him the purifier, but not about because his friend actually stay in hospital. So right now, let us play his video so you can hear about his real story. So Johnny, can you play the video?
大家晚上好，大家好，我是 Kelvin Ning， 我来自Selangor， 拉旺的。首先我要感谢我的介绍人，我的 brother team 领导介绍我这个这样好的产品，也要感谢我们公司的张文凯博士研发这样好的产品。我在4月19号的时候，我不小心确诊了。当我知道这个讯息，医生打电话来讲我确诊的时候，我杀得掉，为什么我会确诊？我会在想，我会感染到谁吗？然后我会想，我会死掉吗？当时有点彷徨，有些害怕。讲真的，那我们知道 我们的氢氧仪哦，有外国政府医院都在用这个氢氧混合来帮助确诊病人。我的 brother team 领导就很快的打电话给公司，叫公司安排邮寄这个氢氧仪让我们使用。很好的，明天第二天氢氧仪就送到我们面前了，我就开始的戏。基本上我是没有什么严重，因为当我们知道确诊了过后，都需要增强的免疫力嘛，对不对？我们都使用很多产品，但是这个氢氧仪我每天使用6个小时，因为在家quarantine嘛，在家里quarantine也不可以去那里嘛，所以我们就一直在使用那个氢氧仪哦，每天使用，早上2个小时，下午2个小时，晚上2个小时。到现在我是4月确诊的，到现在我都没有后遗症，我也没有很喘啊，呼吸很短这样。我觉得我很庆幸可以使用到这个这样好的产品，因为我知道这个产品这样好可以帮助那么多人。我这几个月我是很积极的去分享给我身边的人。在7月跟8月的时候，很不幸有些朋友是很亲的，有一个甚至是我的以前师父，在这个疫情中他确诊了，去世了。因为他有和我分享，我有 WhatsApp 他确诊了，他也是去医院，在医院隔离的时候，我一直在问候他，我是在想给他使用这个氢氧仪，但是他还没出来嘛，在医院不能使用啊。他跟我讲的只是讲他很想出来，因为他在医院不能睡觉，因为他都60岁了，60岁，他讲他平时都很难睡觉，在医院很吵啊，一直咳嗽，他旁边的病人一直在咳嗽，基本上是睡不着觉。因为我是中文懂讲嘛，我是做江酵素的，对健康有一定的认识。因为一个人长期睡眠不好，都会影响免疫力嘛，对不对？所以如果非必要时，我觉得我们不要进医院。如果可以的话，好像刚才之前有分享者嘛，进医院也是没有药吃嘛，对不对？只是给你吸氧气而已啊。我就是听到这种很感触啊，我觉得我很庆幸我可以这样快的使用这个氢氧仪，这家这样好的仪器，也谢谢我的brother帮我这个忙。所以我觉得真的每一个家庭都需要有一个这个氢氧仪来保护家里人，不要等真的是确诊了过后有什么问题的时候才来寻找的时候，好像是慢了一步啊。这个不可以等啊，我觉得这个确诊这个疫情不能等，不是等我们有钱啊，我们经济自由我们才去放这一个。这个如果我是亲身体验啊，我的身边现在开始很多人都很靠近嘛，我们的朋友啊，我们的亲戚啊，有些人很多人确诊，越来越靠近了。所以我用了这个氢氧仪到现在一点后遗症都没有，我也是这样，跟日常生活没有两样。我有些朋友是去年确诊的，呼吸很短，然后很容易累。现在他买了这个氢氧仪，他用了，他讲改善了很多，他睡眠改善了，睡眠也改善了，然后他的也不会很累啊，也不会很累。我觉得我在做一个很好的事情啊，我一直在分享，一直在帮着人呢。我只是想把这样好的产品去分享给多一点朋友，多一点身边的人，可以帮助更多人。我们不要一味的，因为我听到很多在身边很多讲都很害怕这个疫情这样严重的时候，都很害怕不能接触啊。现在可以堂食啊，但是我身边的朋友全部都不敢去堂食啊。我们要照顾好自己啊，要有很好的 SOP。所以我很开心，我接触到这样的好的产品，真的很开心，我这样快可以使用这个产品。希望大家相信这个真的很好，这个我们也调查过，这个安全性跟效果性是很快很明显的帮助人。我身边已经有很多人在使用这个产品，也看到很明显的效果，我也帮助了很多人。谢谢这个3A 公司有这样好的产品，谢谢大家。
So I really want to say thank you, Kelvin, because his story is quite impressive. The reason is because I think a lot of people face the same problem, like maybe your friends that around you that have a case, so they don't have a solution. So what Kelvin says that Kelvin says that it's better for you to prepare one purifier in your home because it's a plan B. Because you always need a plan B. Because if you don't have a plan A and it's not working on you, so you need a plan B. So purifier are going to be your plan B, and somehow it can actually save your life if you're not about get to hospital, because as you know now hospital have a lot of people full of capacity, so you don't have the chance to get to hospital even you are positive. So that's why you must have a purifier within your home. So next we're going to invite another she's not here as well, but it's okay for me to invite her because she we have a recording, so we are going to play another recording. Her name is actually Joyce Goh. She stays in Penang, but her story, I think a lot of people know about the story. The reason is because like what she said, I already get my first dose, but it's so unlucky because after the first dose I was actually tested not me lah, but her, she was actually tested positive. So she gets shocked because she feels so shocked. Really is because she get the disease she got the case from her colleague. It's so normal because why? Because people, they walk around out there, so sometimes they have no idea are they actually get the case, or so sometimes that we cannot control. So that's why there's possibility your relative, your friend actually suddenly visit your home, actually your colleagues, when you're back to your workplace, they suddenly call you and tell you that I'm so sorry because I'll suddenly get positive. So I think it's better for you to get a check. So she faced the same case, but one thing, she's a bit unlucky, not like Kelvin's, because Kelvin don't have any symptoms at all, but she's unlucky. Why I'm saying that is because she has a lot of symptoms. She cannot sleep well. She actually lost the sense of taste and also the smell and everything. So she feels so uncomfortable. But she's lucky that she met our product. She met the hydrogen purifier. So once she able to inhale the hydrogen, she feel better. She actually able to sleep well the first day after 2 hours of inhalations. At the same time, after 4 or 5 days of inhalation, the hydrogen inhalations, he actually start to feel hungry, and she able to get the food because she's lost her taste, appetite for a few days, for at least 5 days. So she feels so happy because she start feel hungry. So let us hear about her story. Can you play the video? So we can actually hear about her story, that how she fight COVID-19.
我是住在大三角的Bukit Mertajam 这里的我是在这里想分享一段我经过的这个已经感染的那个 COVID-19 啊，所以是这个病其实是不是这么简单，也不是这么容易活过来的。所以before 我中的时候是在12号的时候，我是应该要去打第一支疫苗，然后我在抱着很好的心情，就是要快点去打第一支疫苗，然后很不幸的在前一天，我听到很不是很好的那个就是那个信息呢，就是说我的那个同事有其中一个同事呢，他感染到那个 COVID-19 就是中了 positive， 所以他就打电话给我。我那时候心情是整个人都 drop 了的，因为我是明天就要去打疫苗了，所以我的心情呢是50-50啦，就是说希望不要中。然后当我中的时候是在什么时候发生呢？就是说我打了第一支疫苗过后，我回来还是自己买那个test kit 来 try 也是 negative 的，当时第一天，然后我打了回来没有什么症状，就是晚上就开始发冷了。所以那时候我在打疫苗的时候，那个医生特别交代我们是打 AZ 的，所以 AZ 呢，它是会让我们很热气的，它是说3天里面很正常，就是说你会晕会头脑会很晕，而且你会发热，所以我们一定是要吃那个 Panadol 而已，就是他有这样的那个信息给我们，所以我也是抱着这个心情 当我在发热的时候，我也是吃这个 Panadol， 就是希望不要中那个 COVID-19。然后到时候那时候在第二天的时候呢，在第13号、第14号，差不多第二天、第三天开始，我的喉咙开始被割了，就是说感觉到很痛很痛，就是好像从我小到现在啊，从我小到大啊，我是最痛的，就是有一次就是中了那个白喉的痛，所以是非常的痛。现在我又在发现到，哇，我又在中了这个这么重的病，所以我感觉到呢，就可能是有，就是说我是想要去找 clinic， 找 doctor clinic 拿药。那时候我也是抱着没有中 COVID 的心情，然后我去找一个 clinic 拿药。那时候是拿最强的药，也是拿回来吃到差不多2-3天，也是不能解决到我的那个病啊。因为我感觉到这个喉咙呢，它好像被刀刺着的感觉，很痛，它不是肿的痛，所以它是很难去你吞口水，你都会流眼泪的那一种，是非常痛的。当时呢，就遇到我的好朋友那个 Stella 呢，她就有每一个晚上有跟我们沟通啦，就是说我们打了这个疫苗过后，有什么症状啊？那时候我又跟她分享一下，第一天我有跟她分享，第二天又可以跟她分享，第三天直接不能讲话了。我就跟他说，我喉咙非常痛，我不能跟你讲话，不能谈天，只是用按的那个信息来交通。然后之后他就跟我说，因为对他的那个经验的话呢，他是觉得我是98%会中那个COVID-19， 所以他叫我们说你要真正去验证一下，所以我们就 booking 了，我就跟我先生一起中，然后我们 booking 明天的时间呢，我们直接到了18号，我们真正的是确诊了，就是确诊了那个 COVID-19， 所以当时呢，我们的心情是非常非常心痛啊，就是说很不值得，因为我们是刚打了疫苗，为什么还会中？就是很不幸运，所以那时候呢，Stella 呢就是没有二话不说，就是直接安排了一粒那个氢氧仪给我，就是到了我的门口直接放了，他就走了。他是说尽量去吸取这个氢氧仪。那时候氢氧仪对我来说，我一点点都没有了解到，就是完全没有去了解到。当我们中了那个 COVID-19 过后呢，我们才开始真正吸取它的氢氧仪，我才感觉到那个氢氧仪其实对我们来讲是很大的帮助。第一个晚上我吸了2小时就睡觉了，就我感觉到说我们的头直接想要去睡觉，就是直接给我去睡眠很好，就直接睡到4小时、5小时才醒。因为一开始我们中了那个 COVID-19 的几天前呢，就完全不能睡觉的，2小时我就醒了，2小时就起来了，眼睛大大力看电视机，我也不懂要做什么，整身痛，我也不懂要做什么，所以我遇到了这个氢氧仪过后呢，我感觉到它第一个帮助就是让我们睡眠非常好 ，OK。第二呢，就是我感觉到当时呢，我们才慢慢已经感觉到我们的味觉跟嗅觉已经不见了。在第3天的时候得到那个认证的时候，然后我们就很辛苦，而且我们吃不下东西，因为我们没有味觉，所以我们吸不到东西所以我们很难去吃东西。所以我就吸取了这个氢氧仪的第4、5天的时候呢，开始可以吃东西了，开始感觉到我会饿了，因为发现到好像它有慢慢的修补我们的那个肺。而且第3的作用的话呢，我感觉到它帮助到我们的那个肺里面它有积水，所以我们积水那个积水的那个脓呢，我们是干咳的，所以我们咳不出，所以我们就尽量吸取这个氢氧。过后呢，我发现到我们咳出来的就是那个很难咳出来的，好像痰这样子的，我感觉到它有帮助到我很多很多，就是说在我们中了那个 COVID 的第1天开始， 到第7天里面呢，如果你是在最快的速度去医治它，去改善我们的那个肺的话呢，你就会得到很好的改善，就好像一个波这样子。因为我们的那个 period 是14天里面，如果是在你第1天到第14天里面，你没有在第1个礼拜里面呢，你要快点去帮助它复活，就是说修复它。如果你修复不到的话呢，你就很难上波，很难下波了。意思是这样子，所以我们在我用了这个氢氧仪过后呢，在第6天我就发现到我的味觉回来了，第7天我就发现到我的嗅觉38%回来了。所以呢，这个就是它的帮助下，所以我对这个氢氧仪呢非常非常的很有信心，而且很高兴，然后有机会去了解到这个氢氧仪，真正了解到这一粒氢氧仪就是这样。所以我分享到这里为止。
Okay.
Yeah. So thank you, Joyce. Maybe I just get a summary from her story. Like what she said, after she get her first dose vaccination, she tested positive, so it's very unlucky. And she did mention about a few things, her symptoms, example, like she faced a short throat problem, it's quite pain, and she cannot taste the food, she cannot smell at all, she cannot get a good sleep. So she faced a lot of symptoms, and during that time, she don't have a solution. She feels so disappointed. The reason is because she already get her first vaccination. She thought she would be safe, but that's not the story. So after that, she talked about her story with her friend Stella, so that she able to talk on the first day, able to speak on the second day, but on the third day she feels so pain, so she's not able to talk at all, and her whole body is so pain. So she actually have no way. So it's lucky that her friend Stella sent her a purifier on the second day. So she able to get the inhaler. So after that, she able to sleep well on the first day. She able to feel hungry, test her food on the spot on the 5th day. And at the same time, she did mention one thing during when she actually had the case, the COVID-19, she feel that there's something actually stuck in her lung that she's not about to cough out. So after she keep on doing the inhalation, the hydrogen oxygen inhalation, she able to cough up something like phlegm, and she able to get it out. So she did mention one thing, because a lot of people might have this kind of feeling that something is actually stuck in the lung that not about to come out. It's so difficult to cough it out, get it out. So what she did, she actually inhaled the hydrogen and oxygen. So after a few days, she able to cough out all the things that actually stuck in the lung. So this is a sharing, but not just recording. We also do have 2 live sharing from here. One is actually Vilin. Vilin is actually from Sedang, and she want me to mention one thing just now. She said that please mention my age. She's just 24. So she keep on telling me that please mention that I'm just 24. Okay, she's 24, but she's not here just to share her story. She's also here to share her mother's story, because a lot of people maybe their mother have a lot of disease like stroke problem, eye stroke problem, and also have the high blood pressure, hypertension issues, also have the arthritis, and also they have the stroke issue. The high uric acid problem, which means something like gout. So she did actually introduce by Uncle Chu about our oxy-hydrogen purifier. So let me invite Velin to be here and share with us. Velin, are you there?
Yes.
Hi, Velin.
Hello， 谢谢阿 Gancy， 这么棒的把我介绍出来，也非常感恩刚才 Dr. Jerry 这么精彩的一个分享。各位亲爱的朋友们，大家晚上好。我是 Vilin， 我今年24岁，来自雪兰莪沙登。我呢是因为面对到这个妇科疾病呢，才会接触到我们 3A 的细胞量子父亲水。在还没有接触到 3A 的这个医疗器材之前呢，我每一天的早午晚呢，都必须要吃10粒的药源，还有3汤匙的药粉。一整天下来呢，我每天必须要吃30粒的药源和9汤匙的药粉。这一个妇科病呢，它已经折磨了我整整有10年的时间。我有这24岁的身体，可是呢，却像80岁的体质。真的。 可是呢，通过喝了2个月的这一个父亲水之后呢，我的人生呢，真的是大大的改变了。如果大家想要知道呢，我是如何通过喝水就能够改变我的一生呢？可以关注我下个星期三晚上8点半的分享会。也非常谢谢 Uncle Chiu 呢，把我带进了3A 公司呢，让我加入了125团队的这个大家庭。也非常感谢 Uncle Chiu 用心的栽培，还有非常感谢 Dr. Jerry 和麦克创领导呢，对我们无私的协助。所有的这些健康问题呢，他们都会非常详细的一一的帮我们解答，也让我们呢学会了很多的这一个知识。而且呢，我们的产品真正的会说话，除了帮助了我的妇科病之外呢，还有我的哮喘病也是改善了。接着下来呢，我的全家人的面对的一些疾病呢，通通都得到了很好的改善。可是这一些呢，我会在下个星期三晚上8点半的 OPP 分享会呢，为大家做一个更详细的分享，所以敬请留意哦。我真的是很发自内心，很感恩张宏凯博士呢，他研究了一台这么棒的产品，让我呢有着这一个使命感，把这一个大爱健康的产品呢分享给我身边的家人还有朋友，让他们受益。接下来呢，就让我邀请我的好朋友 Stacy 呢，来为我们分享她母亲呢确诊 COVID-19 新冠肺炎的见证。有请 Stacy。
Thank you, Evelyn. Hi, Stacy.
Hi, Dr. Jerry. 非常感恩 Evelyn 把我带入3A 这个这么有爱的这个大家庭。首先呢，我想来为大家分享一下我母亲她确诊这个新冠肺炎的这个过程。在7月份的时候呢，我的母亲很不幸的被感染上了这个新冠病毒。当时呢，在还没有去做这一个检测的时候呢，他是有这个呼吸困难、伤风以及咳嗽，甚至是嗅觉已经没有了。再来就是他有这个结膜炎的症状。什么是结膜炎呢？结膜炎就很像我们红眼症的那个状况，眼睛会红红的。之后呢，这个结膜炎呢是少数人才会有的一个症状之一。接着下来，在第2天，为了安心起见呢，妈咪她就去做了一个全面的这一个冠病检测，报告呢就在第2天的一早已经出来了。当时我的心情呢，就是在准备着要开工的这个心情，但是呢，我却接到姐姐的来电，她告诉我，妈咪她确诊了这个新冠肺炎。当时的我呢是非常的焦虑，非常的难受，还有不知所措的。在这个时候呢，我们全家人都必须去做这个冠病的检测。在这途中呢，我就联系了 Evelyn， 告诉她我的母亲目前的这个状况。当下呢 Evelyn 就告诉我，妈咪必须马上就使用这个氢氧仪。在还没使用这个氢氧仪之前呢，我就让我的妈咪她大量的饮用这个量子能量复清水，也就是大概6个litre。很感恩公司还有爱妙领导，他们在短短的几个小时之内呢，就把这一台氢氧仪送到了我的家。妈咪在使用了这个氢氧仪之后呢，她的那个呼吸困难症状大大的得到了改善。甚至他的那个嗅觉在2天里面已经完全的回来了，而且他的血氧指数一直都是维持在96至98之间。在完成2个星期的quarantine之后呢，我又再次的带妈咪她去这个诊所做第2次的检测。非常开心的是，当下的报告是显示妈咪她是 not detected，也就是 negative 的意思。非常庆幸的是，由于我们全家都有在大量的饮用这个量子能量复清水，所以我们全部都没染上这个新冠病毒。当时呢，妈咪她的指数是处 处于一个非常低，而且非常容易感染人的那个指数。非常感谢张宏凯博士，他研发了这么棒的一个医疗仪器，让我的全家人呢都能得到了这个健康。接着下来呢，我想为大家分享一个我的自身的经历。我呢是一名书记，也就是 admin clerk， 我必须呢每一天都待在办公室长达8个小时，就是每天就必须坐在电脑前面，导致了我有这个坐骨神经的这个问题。当时呢，我的身体是不能够挺直的，每当我一挺直的时候呢，我就感觉非常的痛。无论是我躺着、坐着或者站着，除了痛还是痛。当时每一晚呢，在我要临睡之前呢，我都是以泪洗脸的，因为真的是非常痛。我就像一个老阿嬷这样，每天只能驼着背这样子走路。在有人的介绍下呢，我就去做了这个物理治疗。当时候我的物理治疗的费用呢是高达几千令吉的，但是都不能让我的这个问题根治，甚至是康复。直到我在 Vilin 的介绍下呢，我就开始饮用了3A 的量子能量富清水。在短短的几个月里面呢，我就得到了康复的这个状态。真的很感恩张宏凯博士，他研发了这么棒的这个仪器，帮助了无数的人找回了他们的健康。谢谢大家，我的分享到这里。
Okay, thank you, Stacy, and thank you, Vilin. So, just for information, actually, Vilin and Stacy, they are friends. They know each other. So, both of them just 24 years old, but really actually introduced Stacy because really actually heard about Stacy's story. So heard about her mother's story, that her mother actually is she tasted COVID positive. So she sent her the oxyhydrogen purifier. The reason is because her mother lost her sense of smell and not about to taste the food. Same thing, okay, it's just like the normal COVID-19 symptoms. So she heard about Stacy's story. So that's why she sent her the purifier, because from the very beginning, Stacy, she don't have the purifier with her. So what she do, she actually get her mother to drink the hydrogen water. So she feel better. But after that, really actually introduce Stacy to use the purifier. So her mother actually get better. After 2 weeks of checking, after 2 weeks, she went back to her daughter. She went back to her doctor, and I just found out that she's actually negative, and somehow she feel better after a few days of using of the inhaler, our oxyhydrogen purifier. But actually, Stacy shared about true story, not just her mother. She also shared about her personal health problem, because she's an admin class, so she can only sit in the office for 8 hours every day. So she faces what kind of pain? I think a lot of people have this kind of pain. She faced like sciatica pains, which means something like her backbone have the problem. So she feels so pain every day. She even cry herself during the night time. The reason is because she feels so pain about that. So what she did, she actually drank our quantum energy hydrogen water. So after she drank that, her condition actually get improved. So this is Stacy's story. So I'm very thankful about Vilin, and also thank you about Stacy to share about the story. But just now, Vilin did mention about one thing. If you want to know her story, please stay tuned for next Wednesday, because she's going to be in our OPP and share about her story again, about mother, also about her own story. So actually, thank you everyone to be here. Also, thank you, Dr. Jerry. So Dr. Jerry, there's any other things that you want to share with us? Or if our participants have any questions and you want to ask.
Yeah, let's take a few questions. It's getting late.
Yes. If you guys have any questions.
So sorry. Some of the testimonials, yeah, of course, it's in Chinese. Some of them are more comfortable. But we have good old Nancy, our nutritionist, here to do the translation. But I think most of you can get a feel that the COVID, as we said, is a breathing respiratory problem. So you need a respiratory solution, and the faster you use it, the better. You don't let until the virus multiplies to be a huge load in your body, and then it is very dangerous. Someone mentioned about going to hospitals and quarantine center. As you know, you will be secluded into a COVID ward together with all the other COVID patients. So which means your viral load will increase, your risk is even higher, and you don't get access to many types of medication, supplementation, or food. I have one case now. I don't want to blame the hospital because they are overworked, overloaded. But I have one real case where the old man went in for COVID and she don't even get enough water to drink. She's so thirsty. You know, they run out of water. Can you believe that? So you can imagine that, and no relative can bring any food to you. So end of the day, what I mentioned earlier, protect yourself. When you're still healthy, have your plan B, plan C, plan D all ready. Any questions, Kenzie?
Yes, but before I ask any question, because I think they are typing. Any experience?
Somebody, I saw a
Any
question.
experience using oxyhydrogen in COVID ward or ICU setup?
Okay, yeah, somebody asked how come the hospital or the
Yeah.
government is not introducing this, right? Well, actually, if you go to the MOH website, they did study oxygen, hydrogen, mixed gas inhalation. They have a lot of good things to say. They say that good positive result, this, that. But the conclusion, need further study. So, you know, government don't move very fast. So everything is need further study. And by that time, more people will be dead. So I am in consultation with some clinical centers and hospitals to talk about using it in a private capacity. But I think government will be a bit slower because even to agree, there will be so many committees, so many bosses, so many ministers, then the budget and all those issues. Right now, they re-spend the money on the vaccine. So their focus is that the vaccine will be the solution. But as we know, it is not the solution. So what does that mean? Anyway, we are moving to an endemic. So what does endemic mean? As Dr. Liao said, endemic means chike ku chike. You better get this oxygen hydrogen device and put in your house because nobody is going to give it to you. So you have to think for yourself. For me, less than $10,000 is very cheap. People can buy $100,000 car to drive from A to B. And now lockdown, MCO can't travel, they still have a car. But this is more important than your car. When you are in severe stage 3, stage 4, the car cannot help you. The car cannot give you hydrogen, oxygen. So that's what I'm trying to tell people. You know, don't be silly. I mean, think about it that way. Okay.
Yep.
What other question?
Yeah, I think it's from Agnes. She's asking, can hydrogen water help to improve gastric problem?
Yes, it will. But you see, there is a few types of gastric problem. You have to understand the root cause, okay? Some people, they have gastric all their lives because they don't eat regularly or they have ulcer in their stomach. But if you don't get it checked at least once, you don't know. Because you could have an ulcer, you could have a beginning of something more serious because we don't know. So we always think of gastric, we take a gastric pill to reduce the acid. You got to understand, your stomach needs acid. Your stomach needs acid. Why? To digest the food. You need acid to digest the protein. So your stomach is always very acidic. But why you feel the pain? You feel the pain because the buffer of your stomach, the protection lining of your stomach is no longer protecting you. Maybe there's a hole, maybe there's an ulcer, maybe there's a scar, maybe there's a puncture. Whatever it is giving you that pain. So what you do? You take antacid, you take something to reduce the acid, to reduce the pain. But you need acid, and here you want to neutralize the acid. So you lead to a lot of other problems. So the hydrogen water provides hydrogen to feed your good bacteria. We need a balance of 80% good bacteria, 20% bad bacteria. We have a lot of bacteria in our body, more than cells. So it's very important that we check and find that we need to eat a lot of probiotic. That means yogurt. If you need to take supplement, then you need to take probiotic supplement. But we have already testimonial from a lot of people who have one of the early testimony I received from Singapore was that she used to get gastric all the time, and by drinking the hydrogen water, she was able to not have it anymore. But what I say before is, if you are very serious, or if you take it and the pain get worse for 2-3 days, then it's okay. But if it continues for a few more days, getting worse, or it's not working, then you better have yourself checked, because you could be suffering from something else. What I find also is, for a lot of people get heartburn, reflux, indigestion. Okay, so drinking the hydrogen water also will help.
So another question, Dr. Jerry. I think she's asking, like, is that possible? When we, is it possible we take the antioxidant supplement together with the hydrogen water?
Well, of course, you can take antioxidant pills, whether it's a vitamin or, usually it's A, C, E and all that. Yes, you can take it with hydrogen water. It's not an issue. It's really not an issue, because the water doesn't conflict with the supplement. In fact, sometimes it makes the supplement works better, delivers it better. Okay, and but when you're on medication, sometimes you may, when it comes to drugs, you have to be a little bit careful. When it comes to drug, you don't switch on the hydrogen. You just use the quantum and the MRET. And because you don't know what kind of drug will interact with the hydrogen. But in terms of supplement or vitamins or minerals, those are okay. But be very careful. You don't want to overdose on supplement also.
Yep. Like what Dr. Jerry said, don't overdose and don't overuse it, and don't undertake it. Yeah, so another question, sir. Are we not supposed to use cooked water to process hydrogen water?
You see, what is important is the reason why we boil water. A lot of people, old people especially, they believe that boiling water will kill all the germs and the bacteria and all that. But the problem is, if you have chlorine in your water and you boil it, it actually becomes more cancerous. It will change to chloride and all those things. So you make the chlorine stays even stronger in the water. That's wrong. So what is most important is not boiling. What is most important is a good filter. Okay, you need like a charcoal filter or things like that that can remove chemicals like chlorine, things like that. Once you have a proper filter, the water is clean. Okay, you don't have to boil it, except when you want to make coffee, when you want to make tea. The concept of boiling water, of course, if you go to poor places in Africa or dirty places where maybe the filter also don't have or don't work so well, then you need to boil it. But in developed countries or in better sanitized country, like our tap water is properly sanitized, you can just filter it off, and then you can use the water to make our AAA hydrogen water. That is good enough. All right. Boiling water, after it cool down, and then you use it to make AAA hydrogen water, is okay also. But my only concern is that you're not removing chlorine, which is one of the problems. So you need a filter that can remove chemicals and chlorine and heavy metal. If your water has mercury, if your water has lead, if your water got aluminum, which are all the poison, you go and boil it, it is still there. I mean, boiling doesn't burn away the mercury, right? Or doesn't burn away the aluminum. So what happened? So isn't it safer to have a filter that can remove metals, heavy metals, chemicals, and things like that? You see? So boiling is the wrong thing. It was the right thing many, many, many years ago, because we had no pollution. We don't have metals, poisons, toxin, chemicals, pesticide, all those things going into our water system 50 years ago. But now cannot. So people ask me, boiling is only good to kill germs. That's all. Doesn't get rid of so many chemicals. So it's an old people thinking, but it has changed already. We have to be smart. All right, next question.
Yeah, next question. I think a lot of people think about this. Does healthy people need oxygen hydrogen device even our body can produce it?
Yeah, interesting question. Okay, as I mentioned earlier, our body produces some hydrogen. And if you are healthy, do you need this? The problem I have is most people are not healthy. I have not met 100% healthy people yet. I'm also not 100% healthy. You see, why? Very simple. Do you breathe and do you eat? If you breathe and you eat, your body is producing a lot of oxy radicals.
Yep.
That is why we age. That is why we die. That is why our cells die, right? So nobody is 100% healthy, because the moment you breathe, the oxygen go in. When you eat, the metabolism starts, digestion. When they break down the food, on the side, it will produce all the side effect. That's why people who eat a lot, short life. Yeah, Mahathir said long life is eat very little. Because whenever you eat more, you weaken your body more. So oxyhydrogen is the best to neutralize the disease-causing oxy radical. So you need it even though you think you are healthy. Like me, I'm not particularly very sick, but I know I'm above 60 something. So I try to do 1 hour inhaling, half an hour in my eyes, because we are using computers, handphone, sunlight, a lot of eye damage. I use half an hour in my ear because I hope that my brain can stay strong so they can do sharing. So you see, it's very important that we maintain. See, this question is very strange because my car is running very well. Oh, every day I drive to work, I drive to KL, no problem. That means I don't need to do servicing. I don't need to change oil, I don't need to change filter because my car is healthy. So this is the same scenario with you, with anybody. Don't think that you're healthy. You wake up one day, then you realize it's too late. It's same like your car. Okay lah, still running well. Save money lah, no need to change oil lah, no need to change oil filter lah, no need to change tire lah. So what happened? One fine day is gonna break down and the bill will be very high. Okay? So to answer your question, summary is nobody is 100% healthy. What is more important is to maintain. So hydrogen is the best therapy that you can find that is non-invasive. Even when you swallow a lot of pills, herbs, supplement, it's also invasive. You have to put it inside your body. Hydrogen is proven to be so safe, and yet it is used very well in your body. Why? If you have excess, the side effect will be water, because the H2 will combine back with your oxygen and you get water.
Yep.
Next
so
question.
Another question. I think someone is asking, can baby or infant drink water, the hydrogen water? There's any limit?
I think for young babies, there's no need to drink hydrogen water. Okay. But once you start going to school, like 6 years old and above, I think it's okay to drink like half liter, 1 liter, because at that time you're growing, your cells are dividing, you're doing a lot of exercise, you're running here and there, you're very active. So it's okay to drink the AAA water. But for toddlers, below 6, and especially for babies, I would recommend just very little. Maybe if you're between 2 to 6, you would drink maybe 1 cup a day. If you are below 2, it is really not necessary. Just drink normal filtered water or mineral water is good enough.
So I'm going to ask the last question. I think a lot of people want to know this. Any particular disease that contraindicated to use hydrogen, which means they have conflict. That actually, which kind of disease not about to drink hydrogen water? There's any?
Yeah, somebody asked me a question. It's because we have a certain stomach disease called H. pylori. H. pylori, you can Google this. It is basically a bacteria that infests your stomach, And some people have it, some people don't have it. You can test for it. And if you don't take care of it, it will create ulcers and further down the line, maybe even stomach cancer and things like that. As I told you, our stomach has a lot of bacteria, trillions and trillions of bacteria. And these bacteria feed on hydrogen, whether it's gas or water hydrogen. So the good bacteria, which you have a lot, of course, will grow more. And when the good bacteria is a lot, it will control the bad bacteria. So you don't have to worry. So everybody can drink hydrogen water, everybody can inhale hydrogen. But if you do have H. pylori, we do not want the H. pylori to grow to survive. So you must have it taken care of first, which is why I said earlier, if you have stomach issues, indigestion, you should at least have it checked once. Don't cure yourself. Don't think that, nothing lah, indigestion lah, last night I ate something wrong lah, things like that. Don't become your own doctor. At least have it checked so that if there is a problem, you can fix it very easily. So there is a disease called bacteria called H. pylori, which was actually recently discovered, not so recent now, more than 10, 15 years ago. But that we do not want this bacteria to also feed on the hydrogen. So you want to get rid of it first. But of course, not many people have it, a few % of people have it. But when you go for a test, when you go for your blood test and urine test and all these tests, please include that test in, then you would know.
So
other than that, there's really no any other contraindication for hydrogen. Everybody can take it, use it, whether through water or through inhalation, like I mentioned. And that's why it's one of the safest gas to use. Any more question? That was the last.
last, can I know hydrogen water can improve health for OKU people getting better?
Wow.
People for OKU people, they're asking.
Okay. Well, OKU can be caused by so many things, right? What I can tell you is that many OKU people, they may suffer something. Maybe earlier they get polio or they, have their legs removed or so many other things. But what is important is to take care of the rest of your body. For example, your brain, your muscles, and from infection, your immune system. So obviously, if you consume hydrogen water or if you inhale oxyhydrogen, all these things go to a great length to protect your body. When you are OKU, actually, you are disadvantaged in many ways, right? You can't exercise properly. You can't go out, do the normal things that keep you healthy. So therefore, you have to do more things. For example, if you have early dementia or Parkinson's, or you know that we are heading that way, or even children with ADHD, autism and all that, please seriously consider using oxyhydrogen. Start slow because you may feel some side effect that is part of the healing. Start 30 minutes and then increase to 1 hour and then 1 hour twice a day. Because the gas inhalation is the easiest way to treat anybody. If you ask them to drink water a lot, maybe it's difficult for older people. They keep going to the toilet. But if you ask them to inhale gas, it is easy. So for OKU people, for aged people, for senior people, for nursing home people, for children, disadvantaged children with problems and all that, please use the oxyhydrogen. That's my last message for everybody. And I've seen improvements in many, many cases.
So thank you, Dr. Jerry. Thank you, everyone. And thank you, our tuna testimonial from Rilin, Stacy, Joyce, as well as Kelvin Ning. So thank you, everyone, coming today. And also our Dr. Jiru, thank you so much as a special guest tonight.